microfono e dica buongiorno.
Buongiorno. Si sente, perfetto.
Stai più o meno lì dove vuoi, sul point.
Vado, quindi comincio?
Sì, perché sono ormai stanno parcheggiando.
Sicuro? Okay, so good morning everybody. Thank you for being here. And today I'm going to introduce you two different devices. One has the concept of body reshaping, so it's more indicated for body contour, but of course you can also treat it for face because we are speaking about radiofrequency. And another one is indicated for facial treatment, facial rejuvenation mostly, even though you have also a handpiece for the body, and we are going deeply in this because it's a new handpiece. Regarding Zeta shape, I'm sure you all know radiofrequency as a medical treatment for body recontouring. Non cammina tantissimo.
Avanti o indietro?
Sia avanti che indietro, si muove con lentezza.
Guardare me, punti qui.
Punto lì. Ho puntato lì. Ok, ora va meglio. Devo stare un po' più indietro. This is the right position. I will stay here. Okay, so basically we have a combination of radiofrequency, vacuum for the body handpieces, because we have 3 handpieces, 1 for the face and 2 for the body, medium, large, and small. The small is for the face, the medium and the large are for the body. And the body ones, they have also vacuum-assisted suction, and we are going to understand also what is intended for this application. And the facial one has the radiofrequency only. That is displayed by this sensor that you see here, these little balls that will run over the body, allowing also the massage. So what we have to know that radiofrequency acts like an energy that is delivered through the skin and through the impedance of the skin. The resistance that the skin gives to the radiofrequency action passing through the skin itself will deliver heating, because we know that the energy will be transformed from radiofrequency to the heating process, and this heating process will change the ability of the skin to produce collagen, but more of this to contract, because when we reach 60 degrees into the skin, we know that actually collagen fibrils will contract, giving also a tightening effect. This is how the handpiece delivers the energy. So when we are heating more and more our skin, we reduce the impedance of the skin and we allow the energy to go deeper and deeper. This is also the reason why you can feel a heating effect also over your body that sometimes is comfortable for the patient, but must be and remain comfortable all over the treatment. When you reach the point that you are reaching too much heating, then you have to stop. So for many devices, we needed and we knew about stopping because mainly we do not have any sensor. We were using like thermometers outside to check the temperature. With this device, we know all the time what we are doing because we have the ability from the handpiece itself to check the temperature and give you the feedback when to stop, or if you are not delivering the right amount of the energy in the right way. The suction itself is also useful because we are making a kind of drainage during the treatment, so we need to, of course, do the treatment in the right way to allow this drainage effect, but also because we know that the suction itself is able to open the vessels that are actually over the skin surface. We know that the deeper vessels that are bringing the blood and the supplies to the body, they are almost all open, while the intradermal vessels, they are almost closed in the normal life. So actually we have 90% of these vessels that are completely closed. This is the reason why if we touch our body very often it's cold, and in some other areas it's hotter. The reason is because these blood vessels are open only during, for example, activity. After a run, we feel the heating over this area because these blood vessels are opening. So the only way to open, not with the activity, these vessels, is to use the vacuum. Vacuum will open this and allow us First of all, to remove all the toxins that we have in these areas, reducing the ability of the skin to produce, for example, cellulitis that is made by this product of the metabolism that will stay into the skin. So we are allowing this, reducing these side effects, but also to improve the metabolism of the fat cells themselves, because we want to bring them open again to allow the reduction of the fat deposit. These are the sensors that you see. So depending on the light that you see over the handpieces, you have a blue, a green, or a red light. This means that you are not coupling in the right way. So basically, you always know exactly how you have to apply the handpiece on the body to avoid any burn, for example, that we can sometimes have with different devices, also because you are not delivering the heating itself. So the treatment itself is useless. Of course, the best coupling is the blue LED light. That it means that the skin is cold, that you are bringing heating more and more, and then finally, here you are heating up too much. So this is the perfect color. So when you are heating 40 degrees outside and almost 50 degrees inside, you have this green light. The green light, the area is heated up in the right way, so you can move in another area or on the other side, for example. What I suggest is to cool down a little bit the area before treating it, so you reach the temperature in the right way. So especially the handpiece, sometimes it's very hot after the treatment, so wait a little bit and then move on the other area so the treatment itself is comfortable, because otherwise the handpiece is too hot. But we will see this practically. So you have the large handpiece for bigger body areas like the legs or the buttocks, for example. The medium handpiece for smaller abdomen, especially when you want to treat after pregnancy. If you are using the large handpiece, sometimes the coupling between the handpiece and the body is not perfect because the handpiece is too big and you are sucking too much. Sometimes you can deliver also some ecchymosis. So the best is to use the medium handpiece for this and the small handpiece that is for the face. So you can treat your patient also during your facial treatments in combination with that. The software is very easy, so you will see also the practical part. We can decide the area of the body that we want to treat, the face, the body. The software will tell you exactly which handpiece to use, for example, but then you can decide to change if you think it's too big or it's too small. And also the time that is in preset, the minimum amount of the energy and radiofrequency that you have to deliver. Sometimes if you have a bigger patient, you can increase a little bit the timing, and you can increase also the energy, because it depends how fast you want to reach the heating. So higher is the energy, faster will be the timing that you will reach the final temperature in the area. So especially for the upper abdomen, because the area is quite small, I do suggest to lower a little bit the energies, otherwise the patient will feel the heating sensation that is not comfortable. So reach it slowly. While if you have a bigger area here with fat deposit and cellulitis, if you do not increase, you will stay forever trying to heating up the area. So you can, of course, decide, depending on the patient, which type of energy and how much time you want to stay. We can treat almost all the area of the body, because these handpieces are very comfortable and you can decide the handpiece regarding the area. So you can also treat the smaller area with the facial handpieces if you need to. And you can combine this treatment with, for example, enzymes if you want to reduce faster the fat deposit. So you can combine with the enzymes, you do your injection, and then in 5 to 6 days you can have your treatment applied. This is the facial handpiece and this is the body, very easy to use. You see the handpiece is handy, comfortable, and then actually is not really heavy like for other handpieces, because many other companies, they have handpieces that are very heavy. So if you have people working for you that will stay all the day long with these handpieces in their hands, at the end of the day they are completely destroyed. With this handpiece this doesn't happen, because it's very, very easy to use, and so also it's not really heavy. This is my study. I will show you the patient that has been treated only with this machine. That means that actually as we generally do in our clinic, we never treat a patient only with a device. We always combine for the best outcomes. But we want to know what a device is able to do itself. So what we can achieve if I only have to treat my patient with this device. For example, regarding fat deposit. So all the patients were asked to keep their routine, not to be on a diet, not to train more than before. If they were not training at all, do not train during the treatment itself, to be sure that we are able to understand what the machine itself is able to do. And you see that anyway is able to reduce the fat deposit. What we can tell to our patient, is this machine able to remove the fat? What we know is that radiofrequency is not able to remove the fat, so we are not killing any fat cell. What we are doing generally, we are removing the fat from inside the cells to outside, so actually is a fat redistribution of the area. So it's very important to understand this, because actually there is no report that this kind of devices are really able to destroy fat cells. So if we want to destroy fat cells, we need to combine, for example, with enzymes. But of course, generally, because we are increasing the metabolism, we are increasing the ability of the skin to remove the fat, we can also reduce a little bit fat deposit in a stable way. This is the side view. All the patients were almost 50 plus, so I decided to treat all the patients that were the more difficult ones to understand, of course, the result, because in general, this patient responds slowly in a difficult way to the treatments, so reduction and a little bit of improvement on the skin tightening. This is another patient. You see also the scar here with a very nice reduction of the fat deposit. All the patients were treated actually with 2 treatments twice per week. That means 2 treatments per week, a total amount of 12 treatments. And I can tell you that if the patient can afford only 1 treatment per week, the device is still working good. So if you want to schedule 12 treatments but once per week, you still get your result, because our clinic now, we are doing a different clinical trial for doing only once per week, and we are getting anyway nice results. But I was following exactly the indication of the company. What is nice is that you can also treat in the south of Italy. We have a lot of 10 people, and you can safely also treat 10 people. You see here skin improvement, skin quality improvement, and a better amount of fat distribution. You see the difference? She didn't lose any weight because we still have the same fat deposit on the leg, but the abdomen looks better with less fat. And was treated only the lower abdomen. Cellulitis, for cellulitis we need more sessions. I do not agree that 12 sessions are enough, especially if we have a 3rd degree, like in this case, we have fat deposit plus cellulitis, so we need to go through more sessions. So my indication is to ask the patient, we have a slight improvement and the patient feels better anyway. Remember that these are our clinical reports as doctor, and we criticize a lot the before and after, because we do expect amazing result, but what counts more is how the patient feels. All the patients were happy by the treatment. They said, I see myself way more better, because they look at themselves in the mirror that are different from the picture that are always terrible. If we take a picture of ourselves, we believe that we are a monster. So we always remember that pictures are extremely aggressive from the before and after perspective. But what I love the most is the aspect of the skin quality, because I really think that it works a lot in skin quality improvement. And also because I love polylactic acid, you know, I really care about skin quality, because skin quality I think is one of the most important things that are very difficult to treat actually with devices. And you see here the abdomen completely changed. So what we need to look at is also the quality of life of the patient. If they eat in the right way, they follow the right indication, of course they get better and faster result. Like in that case, look at the side view, the same patient. So really we can get good and nice results. That's why also I decided to combine some of them with polylactic to check what we can get more. All my patients that are going through polylactic acid treatment for the body, they all have body radiofrequency treatment after, because we need to keep the result, but also because when we are aging, actually polylactic is not able to produce in a faster time a lot of collagen. So if I want to speed up the collagen production, especially after 50, I need to combine with radiofrequency, because this will really give me a better result. This is, for example, a treatment in the inner arm, combination polylactic plus Z-shape. And this is the after. And this is nice because this is only 1 session of polylactic plus 7 sessions, half of the treatment with Z-shape. And if I do treat my patient only with polylactic or only with Z-shape, I will never get the same amount of result and quality of result in 1 session, because we need to give the patient the idea of what they can reach. So they are motivated to continue in the treatment session. This is another view with the arm opened. And you see the total different aspect of the skin and the wrinkling of the skin. So we can really improve, especially when the skin is thin, we can really improve in just 1 session of polylactic and 7 sessions of Z-shape the results. So what are the recommendations from the company regarding the number of sessions? Generally, the abdomen are 12. Tights 10 sessions, but I do suggest to do a little bit more. Maybe we can start with twice per week, the first 4 weeks, and then we continue with 1, depending on the type of problem we have. If it's just a question of skin laxity, we can have less session. But if it's a question of fat deposit, I do suggest to have more session. Face 8 sessions in combination or not with treatments. Remember that hyaluronic acid is sensible to radiofrequency. So if you are using, for example, hyaluronic acid that is a free hyaluronic acid only for hydration and skin quality, the best is to combine the 2 treatment. So to do your, for example, profiler or whatever you're doing, and 5 weeks after starting your radiofrequency session. But if you are doing, for example, hyaluronic acid for volumization, the best is to wait at least 2 to 3 months to be sure that you are not reducing the volume of your hyaluronic acid. If you're using polylactic, the amazing part is that polylactic is not affected by heating. So you can heat up your polylactic up to 260 degrees, so you can burn your patient, but the polylactic will be not affected by the heating itself. So actually, it's the only treatment that you can easily combine during the session. So you do your polylactic session, and then you start immediately 1 week after with your radiofrequency to push up, to power up your results. The treatment itself is very comfortable. If you are having the treatment today, you will feel it, you will see how comfortable it is. So for the patient, it's a massage, it's a relaxing moment, and is also a time for skin tightening and body recontouring. And that is all, I think. This is Naples. So come to Naples, to my clinic, to see how beautiful Naples is. Okay, do you have any questions? Do you have other body treatments in your clinic? Do you want to compare? I know all the body treatments, so I can compare everything. Huh? No? Oh, you are still sleeping, so we go for the radiofrequency. Okay, of course, the body treatment, I'm not treating my patient with the body device, you can imagine. I'm a plastic surgeon, so I'm not doing any body treatment in my clinic. I just give the treatment indication, and they will continue with that. But regarding this machine, I love it. I'll tell you that one of my favorite devices are HIFO, actually, and microneedling radiofrequency. The combination of these 2 procedures is amazing. What we can achieve in the rejuvenation process is amazing. And actually, of course, radiofrequency microneedling is only a professional device, so we can only use it. We cannot deliver this machine to any assistant. So actually, it's quite aggressive for the skin, but the amazing part of this device is very, very safe. So what we have in one machine, HIFU handpieces and radiofrequency microneedling. Very handy, useful. That means that they're changing from one to another one is very easy, and you can really combine in the same session or in two different sessions, depending, of course, of the type of HIFU that we are using. In my personal experience, actually, when we are using the combination of the two, we have different degrees of penetration of the HIFU ultrasounds, and we do not really need the more superficial one at the real beginning, because of course we are using the microneedling, and so we are doing almost the same thing at the same level. So this is up to you. What I love the most is the 4.5 handpiece in HIFU, because it directly affects and targets SMUS. Until now, before the arrival of the HIFU devices, we had no other option than lifting. But because we have now HIFU, we can really rejuvenate another part of the aging process, that is the muscle and the fascia, the SMUS. These are the different handpieces. As you see, we have the HIFU that is delivering directly to a target area our energy. The fractional microneedling is passing through the skin through needles. And we have two different types of needles, protected, isolated, and unprotected, not isolated. That means that I can do a full through damage, or I can only deliver my radiofrequency at the tip of my needle. That means that I will be, of course, softer, but also I will reach the target anyway. And the timing of the recovery for the patient is, of course, shorter if we are using the isolated. So if my patient has to go to the work 2 days after, I can use isolated ones. Also regarding the type of the problem, so if I have acne scars and I use the isolated needles, this doesn't mean that I'm not treating well my target. I'm treating very well, but of course I'm not treating also the skin tightening over the surface. When we have, for example, acne scars, we want to recover and completely destroy the scar at the bottom, but we also want to reduce the size of the pores and reduce, of course, the size of the scar over the surface through a coagulation and tightening of the surface. And if I use the isolated ones, I'm doing surface and deep remodeling. If I do isolated ones, I'm only acting and targeting the deep part of them. We have different tips. We have 10 pin for a very nice and soft area like around the eyes, for example, 25 pins and 36 pins. Higher is the amount of the pin, higher is the energy that I'm delivering. And what I want to focus on the most is that I'm doing a damage that is 100 microns for each needle in white. If I'm increasing the timing of the delivering of the energy, because you will be able to do a 100 milliseconds shot, 200 milliseconds shot, or higher. Higher is the energy, bigger will be the hole in white. That means that if I'm increasing this energy and I have 36 pins, the two holes can be very close together. I'm heating up too much and I can have problems. And this is one of the problems that we have with some other devices that are on the market that are very famous, because they are thinking that increasing the energy and the time of delivery of the energy, this will lead up better results. Higher energy and longer pulses very often means more problems, less results. What we need to do is more session if we want to have better result, not really higher energies. So if I'm doing the body, for example, and I'm delivering too much energy in one area in a longer time, remember that this will lead up easily in PAH, post-inflammatory hyperpigmentation, because we are giving too much energy that will shock fibroblasts but also melanocytes, and you will end up in the area that will be completely changed in color. And we are observing a lot of this from other devices. So actually, pushing out the kind of energy and the amount of energy as the best thing as to get the result is not the point. We are doctors. We know that higher energies very often are problems for the CO2, for example. If I use higher energy, I can have more problems. With the fractional ablative, if I use more energy, I lose all the protection that I have and I can burn. And for the radiofrequency is exactly the same. This is not a lifting procedure. This is something that can help you in tighten the skin. That is different. Lifting means that I'm taking my muscle back to the right place. And you are not targeting the muscle, even the body or the face. So if I want to lift my skin, I need to work on septa. That means that I need to work in the deep area between the skin and the muscle. And if I deliver too much energy there, I can have burns or I can have PIH, post-inflammatory hyperpigmentation. In Italy, I don't know about here in Romania, but I'm treating more side effects from other companies than sometimes first patient for this type of treatments. What we can treat acne, scars in general. So if you have body scars, we can also deliver drugs. So if you want to treat, for example, basal cell carcinoma with a 5-fluorouracil, you can make your hole, you apply your 5-fluorouracil on the surface of the tumor, and you have a drug delivery system directly through the hole. Pore reduction, skin tone improvement, and stretch marks, of course. And lifting, I don't like this word. Tightening, wrinkle reduction, and skin rejuvenation, and of course, collagen improvement. Eyebrow, double chin, and volume reduction, because we can also treat this area with the microneedles, again, also in combination with the enzymes that I know that you use. So we can use fat reduction enzymes, and after or before we can use our microneedle device. This is how the handpiece looks like, very comfortable. You have the control button there. The vacuum that will help you to be in the right level of the skin each time, so it's not handy dependent. Doesn't mean that if I press too much or a little bit less, I will be deeper or less deep. So it's very important that you apply the right amount of the energy during the treatment itself, because the vacuum will do its work, bringing the skin back into the handpiece and allowing the needles to go deeper. And what is important, you see here, where we can reach between 0.1, that is very useful for around the eyes, because we have a depth of the skin that is between 0.05 and 0.1, so is enough for the around the eyes, with a depth up to 3.5 millimeters, so very high level of precision. Oh, sorry, I'm going back. Okay, this is how it works. We apply without too big pressure over the handpiece. The suction, the vacuum will bring the skin into the handpiece itself, and the needling will be delivered into the skin, and then the energy. In this case, of course, we have non-isolated, because the energy is delivered all over the needles, but we can also have the energy delivered only on the tip of the needle itself. And this is why the vacuum is so important for us. But there is also another important thing. We know from the other devices that they are very painful. And we know that the vacuum itself is able to act over the pressure sensor of the skin. So we are like disturbing the skin, giving two different information. One is the suction, the other one is the pain. So we are reducing a lot the pain. It's like for the body treatment itself. When we are using vacuum, this will reduce the sensation of the pain. Of course, we apply anesthetic creams before the treatment, because this will make the treatment itself more comfortable. But compared to the other machine, this is a way less painful. We can do 1 passes, 2 passes easily on our patient. Sometimes they do not feel end thing. They say, oh, do you really actually doing the treatment on myself? And compared to other devices that I'm using in other clinics, I can tell you that this makes a big difference. Some patients, they say, because of the pain, I will never get another treatment, even if it's good treatment, because pain is an important part for our treatment, and we have to consider as doctor, more comfortable the treatment is for the patient, better the patient will feel after, and also follow the rules after the treatment. These are the isolated ones. You see the energy is delivered only at the tip, so we decide how deep we want to go. And they will also give you, or I think you have in the guidelines, the different depth of the skin. Of course, this is not a standard because it depends on the aging of the process of the patient, because in aging patient we have thinner skin. So always start with lower depth of penetration, and then you can increase session by session. Here you have the settings that you can have, so you can count the number of the shots and the treatment settings, and of course your tips are one use. That means that you have one tip for each patient, and then you have to throw the tip away. These are some patients. This is only after one session without any other treatment. So only before and after neck treatment with microneedling. You see that we can really improve the tightening of the skin. In this case, I was using, because I was scared, were my first patient, the isolated tips. That means that I'm not reaching for sure a high energy through the skin. I was reaching maybe part of the mass and part of the skin, but you see only after one session the patient is very, very happy. And this is another patient before with the second and after. I love microneedle, especially for the neck. I do combine a lot. All my patients, they do 3 sessions of polylactic and 3 sessions of microneedle for the neck. You see to the side, these are 3 sessions. Only neck treatment. Look at that patient before and after the session. So you can really tighten the skin, remove the skin excess through a skin elasticity improvement. And this is because, of course, we are acting in different levels, skin, but also mass. This is a younger patient in the submental area. We need to combine, of course, the treatment also for the face, because we need to tighten also the face, because some of the skin here at the mandible area is because of the face. So we need to treat the face and the neck. And we can also think about combining, but I'm showing you only the picture before and after using one device. You can imagine that in combination, you can increase the result and getting amazing result. The difference in the handpieces for the HIFU is that we have different cartridge. 1.5 for superficial dermal lesion. 3 is for deep dermis. That means that I can increase the collagen production in the same way I'm using the microneedles. So for example, if I need to treat my patient during the summer season, but I cannot go through microneedles because they need to go to the summer, or they have, for example, winter vacation, we can increase the collagen production in the deep dermal layer using this 3mm cartridge, because with a HIFU we have no side effects at all. So they can have the treatment the day after they can go to the summer season, sunbath, or wherever they want. And this is amazing, especially when you have aging patient. But honestly, for me, this is more painful than the microneedles. So if you are targeting the patient with the 3mm hand pieces or the 4.5, 4.5 is almost no pain. Even if we are going deeper, with the 3mm is a little bit more painful. And because we are using HIFU that are ultrasound, it's very difficult to reduce the pain with the cream. You can apply the cream, but it's still painful. So compare the 2 levels of devices. If you can go through microneedles, it's better than with this regarding the pain. The one that I love the most is the 4.5. The 4.5 we can combine in the same session with the microneedles. We do the 4.5, we have a very mild edema, it's a very little, that is in the deeper part of the skin, so we can control and do our microneedles over. So if we want to combine in the same session, we can do passage with the 4.5 and going through this mass tension, giving the patient immediate result, and then after go with the microneedles, for example, over the neck to improve the results. How is delivered the energy? You see the different depths with the 1.5, the 3 and 4.5. And what important thing again with the ultrasound is the same like for microneedles. Increasing the energies doesn't mean that we are reaching the goal. We need to keep the treatment comfortable because that means that we are going in the right place without having side effects. I will show you what happens if you increase too much the energy. You are increasing side effects without getting results. This is important because we need to keep our energy into the target area. For example, for the 4.5, if the treatment is not painful almost at all, you only feel some puncture sensation, means that we are right in this mass without affecting deeper the muscle, so we are not going to have petechiae, because if we are increasing the energy, then the patient will have petechiae over the skin. That means that we are using too much energy, and so the target is not anymore in this little tiny fascia that is this mass. We are going deeper into the muscle. Or with the 3.5, we have like bumps over the skin because, again, we are increasing too much the energy, delivering in one area, and this will create edema into the dermal layer or increase the glands. This is how it's designed at the target. You see it's very precise. That means that we have lower rates of side effects also in the area where we have nerves, because there are reports of nerve damage, for example, at the level of the mandibular submentalis nerve, mandibular nerve here, because this area we do not treat. But of course, if I'm treating the neck and I'm going down over the mandible border, I'm close to the nerve, and I touch the nerve for one shot, and the patient says, oh, ouch, that means I just need to move. But if I'm increasing too much the energy, I can create a damage over the coverage of the nerve and have some side effect. But when it's so precise, it's very difficult to create a big damage. So it's very important that we keep our treatment with safer device. We have mainly 3 different shapes of ultrasound deliver energy. One is like a cone from the first machine that was actually built and delivered actually. One other that is more like a line. So we are delivering anyway the energy all through the skin. And this one that is very targeting. So the major amount of the energy is all at the level that we decide in the depth. And the demonstration of this is that if you are treating side by side, that's what I'm doing in my clinic because I have multiple machines, one side with one machine and another side with the other machine, you feel the difference in the sensation. This is definitely less painful. Getting the same results means that I'm targeting the target without affecting the surrounding tissues. More superficial you are with the energy, more pain you have. These are all the areas that we can treat. Of course, the contraindication that you know, keloids patient is not really I think that we have to remove, because actually I'm treating with HIFU all my patients with keloids with no problems. Of course, these are general rules that we always use for all laser, all devices, but it's up to us as doctors to decide which patient can go through and which one is not going to go through. Patient with fillers, for example. If we have nodules, for example, with polylactic acid, ultrasounds will help like radiofrequency in reducing the size of nodules. So why not treating this patient that have fillers with the device? And regarding the hyaluronic acid, if I'm treating my patient with the 4.5 handpieces, there are no reason not to combine with fillers. Or if my patient have fillers in the zygomatic area that I'm not treating with ultrasounds, because we generally work behind. There is no reason not to treat them. So, of course, it's up to you, but there is no reason to skip this patient, because mostly of the patient, they have fillers. So who remains? 10 patients to treat with a HIFU? So we can treat patients with fillers. There is no problems, no side effects, no possibility of reabsorption. Of course, we just stay 2 to 3 months if the area is exactly the same. So if I'm treating cheeks, for example, with HIFU in the deeper layer, and I'm just injecting my patient with Restylane Vital, for example, I'm not treating in the same time. I just wait 5 weeks, and then I start treating the patient with HIFU. These are the handpieces for the microneedling, the characteristic that you see if you want to compare with other machine. And these are some results only with HIFU. Again, we can combine with, for example, lipolytic agents. We can combine with microneedle radiofrequency, but this is just to show you what happens if I'm treating with a HIFU. What is important is, if my patient is not treated before with fillers or with polylactic, result sometimes comes after 4 or 5 months. So it's very long time that you have to wait. So what I do suggest is to pre-treat your patient with fillers or with polylactic acid before any HIFU treatment, because this will give you immediate result, and you will see result side by side and show up to your patient. She will see immediately the lifting of the cheek area or the reshaping of the submental area. So I think that pre-treating the patient is always a good thing. This is a 3D camera to show you the improvement to the area of the cheeks. You see how higher and the remodeling of the submental area. This is, he is 70 plus. So can we get results over also very aged patient? You see, yes, you see here in the nasolabial fold and the tightening of this area. This lady again, cheek area and submental area. But again, after 6 months. So you really need to wait at least 6 months. This is very important, otherwise it's very difficult to see improvement into the skin. But you see that if we treat also with the other handpiece, we have an improvement also in the skin quality, in the pores, and in the skin tightening effect. For the skin color, I always pre-treat my patient with glycolic acid and retinol. All my patients, they do this treatment 6 months at least. This is another patient, submental area, and fat reduction. Side effects, just to show you why we have to increase too much the energies. There is no reason for doing that. We have these like papules over the skin. So don't worry, nothing happens, nothing will last, so you can reassure your patient and also the doctors if you are receiving a phone call from a doctor that is having this papule over the skin. Just apply corticosteroids or anti-inflammatory creams to reduce the inflammation. But again, it's very important, if the patient refers too much pain, just lower a little bit the energies, because this doesn't mean that you are not getting your result. And this is another example of petechia that comes sometimes after 1 or 2 days after the treatment, because we are increasing too much the energy. For example, in this area, there is no reason to increase the energy in that area, and we are having this result. This is with the 4.5. The other one is with the 3 millimeter hand pieces. Okay, so thank you. Questions? No? Everything clear. Perfect. Okay, let's go for the practical part. Coffee? Sì, se non hanno domande.